Hello and welcome to another live broadcast with MedStar Health. My name is Mashan Bowman, and today we are at the new location of MedStar Greater Annapolis Medical Group. I'm joined today by Dr. Kosmos Papailiadis and Dr. Kevin OKeefe, internal medicine physicians here at the practice. Thank you both for joining us today and taking the time with us. We're excited to be at this new location. Before we dive into our questions, Dr. Pabloliadis, could you tell us a little bit about yourself and what you do here at MedStar Health?
Sure. So I'm an internal medicine physician working here in primary care. I joined the practice in September. I was a hospitalist for 4 years prior to this over at MedStar Washington Hospital Center. Graduated from residency in 2016. Did my med school at St. George's University Medical Center. And been with MedStar pretty much my entire career.
Awesome. Thank you. Thanks for joining us. Dr. OKeefe, tell us a little bit about yourself.
Sure. So I've been in private practice for 32 years. The last 3 years with MedStar. I'm a board certified internist. I went to University of Maryland Medical School and did my residency there. I've been in primary care all my life, and I've really enjoyed doing it.
Awesome. Well, thank you for joining
Sure.
us. So, Dr. Papailiadis, let me ask you some questions about the new location.
Sure.
So, when did you all relocate, and how do you like the new space?
So we moved over here at the end of November, just the week of Thanksgiving. We love the new space. Huge exam rooms, large waiting area, large lab, ample parking for our patients. So I think it's been a huge improvement.
Awesome. And what makes this location different from your other office?
So I feel like this location is more convenient for our patients. We're located right off of Bestgate Road, so pretty easy access. We have above ground, free parking, so much easier to navigate for our patients. And we have easy access from the parking lot right to the clinic. So I think overall it's just a more convenient and pleasant experience for our patients.
Awesome. Anything you'd like to add?
No, we've had parking nightmares at our ex-location right at the hospital, but that was a big problem for our patients. Plus it's really nice that the ground level parking lets people park right next to the door. No lobbies, no elevators, which in this kind of environment, coronavirus-rich environment, really helps people a lot. I might say too, in this location, we can have, if you're really concerned about the safety, we'll let you stay in your car. Give us a phone call and we'll bring you right into the exam room so you can skip the waiting room.
That's really good.
For high-risk people, that's probably a good idea.
Yeah.
So, sure.
Good point.
Yep.
Thank you. And what services are currently available out there at OKeefe?
So we're an internal medicine primary care office. So we're here to address the healthcare needs of adults over the age of 18. We are looking at potentially introducing some subspecialty services on a rotating basis here. So that's being planned for the future.
Great. And you mentioned specialty services available as well. Correct?
Yes, so we are looking at several different options. We've been deliberating with MedStar about that, what would be the best fit for the practice and what the greatest need is. So we're hoping to bring a few people on board soon.
Great. Let me transition to New Year's resolutions. We're in 2021, finally over 2020, and people may be thinking about any New Year's resolutions or making lists or trying to achieve their goals on that list. So why is it important to have a primary care provider?
Well, I think it's important because when it comes to sick visits, annual checkups, it's always best to have someone who really knows you, knows your medical history. I think this really helps to facilitate early diagnosis and early treatment.
Anything you'd like to add, Dr.
No, I couldn't agree with you more. I've done this so long, I know patients without a chart. When I get a phone call, I kind of know immediately what people need. When you're dealing with strangers, with difficult problems, you're definitely getting less focused, less intelligent care. So having that relationship is really important.
I agree. Thank you. So even during COVID-19, it's important to keep your annual checkups and to schedule an annual checkup with your primary care provider if you haven't already.
Sure. Yeah.
For those who may be concerned about safety, what protocols are in place to ensure that we're safe and ready to see patients?
So I absolutely agree with that. As we were saying before, we follow very strict protocols when it comes to social distancing, wearing personal protective equipment for every single patient encounter, and as Kevin pointed out, we also have the option of having folks wait in their car instead of the waiting room, and just bring them directly into the patient room to limit potential exposure and contact with other people. We also have hand sanitizer stations located throughout the clinic that helps keep everybody safe, everybody healthy.
Great, that's very important. The beginning of the year provides a great opportunity to set goals, as I said earlier, and to focus on self-care. So we know that now more than ever, it's important to take time for yourself and care for yourself. So how can your primary care provider help you with that?
Well, it's a good question. I think it's important to see your primary care in order to really establish your baseline, kind of know where you are as far as your baseline health, and really come up with a plan to address any needs, or concerns that either yourself or your primary care might have. And one of the things that we really try to do at this practice is try to come up with something that works with the patient schedule, that's convenient for them. We try to be as accommodating as possible.
That's good. So thank you. At this time, I just want to take a pause and welcome any new viewers. Thank you very much for tuning in. If you're just joining us, we are here at the new location for MedStar Greater Annapolis Medical Group, discussing the services that we provide here. I'm joined by internal medicine physicians, Dr. Kosmos Papailiadis and Dr. Kevin OKeefe. We have more to talk about, so keep watching. Share this broadcast with your friends. Give us a like to let us know that you're watching, and ask us questions in the comments below. We're going to take some time to answer those as well. At this time, we're going to turn over to Dr. OKeefe and talk about